Hi and welcome to Heal My Hemorrhoids. In this video you will learn thrombosed hemorrhoids, what tips and tricks to use when treating hemorrhoids. Remember to hit the like button and subscribe for more videos. Thrombosed hemorrhoids can affect anyone who has had hemorrhoids for a long time. It may cause more serious health complications as well as a major hindrance to the continuity of work and the normal life of life. Thrombosed hemorrhoids develop from internal or external hemorrhoids, and they are considered a complication and harm of neglecting hemorrhoid treatment. Thrombosed hemorrhoids are also swellings and stretching of the hemorrhoidal tissue, which results in inflammation and pain in the anal area. This is many times accompanied by bright-colored bleeding on the stool or on the tissue. What causes thrombosed hemorrhoids to bleed? Thrombosed hemorrhoids are swelling and stretching of the hemorrhoidal tissue, resulting in inflammation and pain in the anal area, accompanied by bleeding with bright color on the surface of the stool and blotting paper. Hemorrhoids are caused by intense and continuous pressure on the anal area and the muscles of the lower pelvis, which weakens the veins and impedes the normal movement of blood in and out of the veins, so blood retention leads to swelling and pain. It is called a thrombosed external hemorrhoid, which is a hard, painful tumor that appears suddenly around the anus, and is caused by bleeding in the vessels of external hemorrhoids, and this happens either as a result of severe diarrhea or because of constipation, and pressure during defecation or sitting for long periods. This bleeding may occur. Thrombosed hemorrhoids are a type of external hemorrhoids and it is the most common hemorrhoids in anal diseases, which often occurs from eating spices, hot peppers, and excessively hot peppers, which irritates the veins under the skin in the rectum. Thrombosed hemorrhoids symptoms. Thrombosed hemorrhoids, it is one of the types of hemorrhoids in which the blood is clot inside and thus blood does not flow in it, and often these hemorrhoids are external, but they may be internal in some cases, and they are not dangerous, and they are accompanied by a group of symptoms, a feeling of severe pain, and this pain is caused by a blood clot, and it starts within 48 to 72 hours of the formation of the clot, and usually the intensity of pain subsides on the fourth day of feeling the pain, and if the pain is present without the appearance of hemorrhoids, then the cause of this pain must be searched. It may be caused by the injury. Anal fissure. Infections. Swelling of the area. Thrombosed hemorrhoids are a swelling that appears near the anus as if you saw a swollen grape seed, and the skin of hemorrhoids sometimes thinning, and it is either round or oval. Causes of thrombosed hemorrhoids: 1. Spicy foods such as pepper, chili, and black pepper. 2. Severe constipation. 3. Too much sitting on the toilet. 4. Rupture of veins under the skin. 5. Excessive exertion or strenuous exercise. 6. Severe coughing during defecation. 7. A problem in poor circulation that leads to pressure on the abdomen increases, as does blood flow. The rapid expansion of blood in the vein and congestion and is due to a lack of smooth circulation in the blood. 8. Eat high-fat foods, spicy foods, and stimulants. Thrombosed hemorrhoid side effects. Hemorrhoids are a common and minor problem, and the condition may be chronic and painful, but in rare cases, hemorrhoids may be very annoying, and often they do not result in health complications. The formation of thrombosed hemorrhoids arises as a result of the formation of blood clots in the hemorrhoids, and although this condition is not dangerous, it may result in severe pain, which requires taking appropriate measures to control the condition. This includes cutting it and removing or draining the clotting. And in the event of complications, they may include the following: anemia. Chronic hemorrhoid bleeding may sometimes lead to anemia. This is represented by the inability of healthy red blood cells to transport sufficient amounts of oxygen to the cells of the body. The formation of strangulated hemorrhoids, which is the result of the interruption of blood flow to internal hemorrhoids, and this leads to the feeling of severe pain, and it should be noted that strangulated hemorrhoids increase the risk of infection. Prolapse of hemorrhoids. This is characterized by the prolapse of internal hemorrhoids to the outside and the inability to push it inward. This makes it a chronic condition, and in rare cases, this prolapse may lead to some complications. Treatment of thrombosed hemorrhoids. The treatment of thrombosed hemorrhoids depends on reducing the symptoms, eliminating the causes, treating the patient's complications, and eradicating the swollen and prolapsed hemorrhoids. 1. The diet. The diet of a hemorrhoid patient must be modified, after eating pepper, mustard, hot sauce, garlic, black pepper, and cumin, and this is because these spices irritate the rectal wall, which worsens the matter and worsens hemorrhoids. 2. Eat foods that are filled with fibers such as spinach, rice, and fruits such as watermelon, bananas, and apples, and this is so that you do not become constipated, which is a major cause of hemorrhoids, so the bowel movement will subside and the swelling subsides. Constantly cleaning the anus after defecation, and this is with betadine so that germs do not spread and reactivate. 4. Relax on the bed and raise the legs. 5. Make a water bath consisting of 2 liters of water and the water is warm and a teaspoon of salt about a quarter of an hour a day once or twice, and God Almighty wills, the swelling will disappear and it is possible to use some anti-inflammatory drugs with it to speed up the treatment. Usually, a clinical examination is sufficient to diagnose a thrombosed hemorrhoid, but sometimes the doctor may need to conduct one of the tests to rule out other problems such as colonoscopy and rectal exam. Barium enema test. Thrombosed hemorrhoid surgery. Usually, surgery is used to remove a thrombosed hemorrhoid. It is a simple and painless local anesthesia procedure in which the surgeon cuts the affected hemorrhoidal tissue and drains the blood. This procedure is most effective if it is performed a few days after the appearance of blood clots in hemorrhoids. But in some cases, other treatments may be needed to get rid of infections before the procedure. Thrombotic hemorrhoid surgery may be performed in 2 stages, the stage of draining or removing the blood clot coagulated, then the stage of removing the hemorrhoids. In some cases, the anal abscess is formed along with hemorrhoids as one of the complications, so early diagnosis by a specialist doctor is the first effective treatment method, and there may be other non-surgical procedures such as rubber band ligation, injection, cryotherapy. What is written in this article is for educational purposes only, and it cannot be considered a prescription as a substitute for a visit and follow-up to a doctor, as each person has his own case that needs a different type of treatment. Thanks for watching, don't forget to hit the like button and subscribe for more videos. Hope the video was helpful.